Welcome to Nursing Point YouTube channel. Today we are going to talk about nursing question and answer for AIMS nursing examination, MRB nursing examination, CMC nursing examination and all nursing examination. Model question and answer.
You are preparing a presentation for your classmates regarding the Clinical Care Coordination Conference for a patient with terminal cancer. As part of the preparation, you have your classmates read the Nursing Code of Ethics for Professional Registered Nurses. Your instructor asks the class why this document is important. Which of the following statements best describes this code? 1. Improves self-health care. 2. Protects the patient's confidentiality. 3. Ensures identical care to all patients. 18-year-old woman is in the emergency department with fever and cough. The nurse obtains her vital signs, listens to her lung and heart sounds, determines her level of comfort, and collects blood and spubbles or analysis. 1. Diagnosis. 2. Evaluation. 3. Assessment. I4. Implementation. Answer is 3.
A patient in the emergency department has developed wheezing and shortness of breath. The nurse gives the ordered medicated nebulizer treatment now and in 4 hours. Which standard of practice is performed? 1. Planning. 2. Evaluation. 3. Assessment. 4. Implementation. Answer is 4. A nurse is caring for a patient with end-stage lung disease. The patient wants to go home on oxygen and be comfortable. The family wants the patient to have a new surgical procedure. The nurse explains the risk and benefits of the surgery to the family and discusses the patient's wishes with them. The nurse is acting as the patient's 1. Educator. 2. Advocate. 3. Caregiver. 4. Case manager. Answer is 2. The nurse spends time with the patient and family reviewing the dressing change procedure for the patient's wound. The patient's spouse demonstrates how to change the dressing. The nurse is acting in which professional role? 1. Educator. 2. Advocate. 3. Caregiver. 4. Case manager. The answer is 1. The examination for registered nurse, RN, licensure is exactly the same in every state in the United States. This examination 1. Guarantees safe nursing care for all patients. 2. Ensures standard nursing care for all patients. 3. Ensures that honest and ethical care is provided. 4. Provides a minimal standard of knowledge for an RN in practice. The answer is 4. Contemporary nursing requires that the nurse has knowledge and skills for a variety of professional roles and responsibilities. Which of the following are examples? Select all that apply. 1. Caregiver. 2. Autonomy and accountability. 3. Patient advocate. 4. Health promotion. 5. Lobbyist. The answer is 1, 2, 3, 4. Match the advanced practice nurse specialty with the statement about the role. 1. Clinical nurse specialist. 2. Nurse practitioner. 3. Nurse midwife. And A. Provides independent care, including pregnancy gynecological services. A. B. Expert clinician in a specialized area of adult diabetes care of practice such as C. Provides comprehensive care, usually in a primary care setting, directly managing the medical care of patients who are healthy or have chronic conditions. The answer is 1B, 2C, 3. Healthcare reform will bring changes in the emphasis of care. Which of the following models is expected from healthcare reform? 1. Moving from an acute illness to a health promotion, illness prevention model. 2. Moving from an illness prevention to a health promotion model. 3. Moving from an acute illness to a disease management model. 4. Moving from a chronic care to an illness prevention model. The answer is 1.
A nurse meets with the registered dietitian and physical therapist. to develop a plan of care that focuses on improving nutrition and mobility for a patient. This is an example of which quality and safety in the education of nurses, OSEN, competency. 1. Patient-centered care. 3. Teamwork and collaboration. 2. Safety. 4. Informatics. The answer is 3.
A critical care nurse is using a computerized decision support system to correctly position her ventilated patients to reduce pneumonia caused by accumulated respiratory secretions. This is an example of which quality and safety in the education of nurses, OSEN, competency. 1. Patient-centered care. 2. Safety SOMENT. 3. Teamwork and collaboration. 4. Informatics. The answer is 4. The nurses on an acute care medical floor notice an increase in pressure ulcer formation in their patients. A nurse consultant decides to compare two types of treatment. The first is the procedure currently used to assess for pressure ulcer risk. The second uses a new assessment instrument to identify at-risk patients. Given this information, the nurse consultant exemplifies which career? 1. Clinical nurse specialist. 2. Nurse administrator. 3. Nurse educator. 4. Nurse researcher. Answer is 4. Nurses in an acute care hospital are attending a unit-based education program to learn how to use a new pressure-relieving device for patients at risk for pressure ulcers. This is which type of education? 1. Continuing education. 2. Graduate education. 3. IN service education. 4. Professional registered nurse education. The answer is 3. Which of the following internet resources can help consumers compare quality care measures? 1. WEBMD. 2. Hospital Compare. 3. Magnet Recognition Program. 4. Hospital Consumer Assessment of Health Care. 5. The American Hospital Association's webpage. The answer is 2. 4. Which of the following